So today we're going to talk about nerve block injections. Simply, what are nerve block injections in the first place? They're a series of injections via needle to the soft tissue around a specific nerve to help alleviate pain. The whole concept of it is that with the numbing of a certain nerve for a period of time will stop or limit the amount of pain sensitivity that a person will feel in that specific area. For example, if one has excessive migraines, especially in the temple area or back at the where the brain stem is located, that getting a series of injections in the neck and around the temples, it will help alleviate that pain, those migraines, for a specific period of time, that for a certain period of time, I should say, because it is not very a specific science. It's not an exact science. For some people, getting an injection once every 6 months does the trick. For another, once every week works. For me, I get them every single week in my spine and in my neck, as well as my tailbone. And the way that it lasts depends on a huge number of factors that I will also list on my website to help you sort of gain a better understanding. But this is just a quick and dirty video, so more information will be there. But what I want to talk about right now is what you should expect if you are going to go for nerve block injections and you've never had them before. This is what you should be expecting. There are a number of drugs, first of all, that are quite popular, like Marcaine, Carbocaine. Some people even use cortisol. Cortisol? Yes, cortisol. But it all depends on a person's medical history, I should say, as well as their body chemistry, how they were injured, what exactly they have, whether it's lupus or fibromyalgia, chronic pain, or a combination of them. It's honestly, each doctor has their own preferential drug that they use, as well as solutions to dilute it in. For certain people, it may be a sugar solution. For others, it may be saline. It all depends on the doctor and where you are in your actual area that your doctor's office may be in, may have different solutions available to them. It's really a numbers guessing game at this point, but what you should expect is this. When you first go in for your first appointment, a good pain center, pain clinic, wherever you are getting your injections administered, a good clinic will have you fill out a numerous amount of forms, as well, including your physical functionality, your ability to to do hobbies, social activities, housework, simple everyday life exercises such as breathing, eating, sleeping, showering, getting yourself dressed, listed, and you will have to either describe or rate it on a scale of 0 to 10, 10 being the absolute worst, you cannot do it, or maybe 10 may be the easiest. All depends. But for sure, a good clinic will have you fill out a lot of forms. It will have a nurse sit down with you and explain in in-depth detail as to what you will be receiving, how often you should expect, for how long you should expect a soreness in the area of injection, as well as any side effects you may get from the injections, what to do in case of serious side effects, as to these are the effects that you have to go for sure to the hospital. You cannot just ignore it, as opposed to slight tingling in the sensation or bruising, that's normal. If you are excessively bleeding, you should probably go to the hospital. I think that is a very sort of glaring, obvious red flag right there, but you know, some people may not know that. So a good clinic will have a nurse sit down and talk with you about it. A good clinic will also have, every time you come back for a visit, it will have those forms again saying your physical functioning for the week, or from the time from your last injection, as well as any new medication options, or options I should say, changes, any changes in your mood, in your coping ability, in family and social relationships, in sleeping habits. Sleeping habits, if your clinic does not mention sleeping habits, then you should probably leave. Sleep, especially restorative sleep, if they're not monitoring that, if you're not monitoring that and you're not sleeping, you are never getting better. You are never going to have any relief, let alone getting better. You will have zero relief. You will just be in a constant state of anxiety and pain. So, how to prepare for your first visit, for your first set of injections, more specifically. Firstly, bring a friend. Do not drive yourself. Please do not expect to take public transit home if you can help it. If your financial, if there's a financial strain on you and there's no one you can ask to give you a ride, and you have no other option to take a taxi, then I can understand. But if you have the option to ask somebody, hey, I'm gonna go get a series of injections that are probably going to numb me to the point that it's not safe for me to drive. Can you take me? Please do it. Also, for my first appointment, I brought a pillow. It was quite comforting to have the pillow, especially to have it on my back where I was getting my injections, but also because I am a big baby when it comes to injections. So I had my pillow, actually I can show you. I had my pillow right here, and I held it like this. And this was very comforting. If you cannot do this, holding someone's hand also helps with the anxiety part of it. You should also bring a snack. Always bring something to drink. If it's your first appointment, I would suggest something a little sugary, maybe a juice if you can. If not, then I guess, you know, a smoothie or maybe a pop. I wouldn't necessarily recommend the pop because of the caffeine that could be in it. But definitely a water bottle, definitely something as a snack. I went with a granola bar and a juice box. That helped quite a bit. Also, take a notebook with you. Have something that you can show, that you can have as a visual for yourself as to how to track pain. You need to know how your pain progresses with the injections to see if it's even worth it to have them. Because for some people, it's just not. It is an option to you, but if it's not working, there's really no point in getting them. For side effects, you are going to feel sore. It's going to hurt, especially in places where you are sensitive. In my neck, every single time, no matter how many times I've gotten it, I think I've had them in my neck for about 6 months, every single time I cry. I am screaming out in pain because it hurts. It is so sensitive right here for me. I get migraines, and having needles injected right here, oh, it's very tender. So you're going to feel sore there for about maybe half hour to an hour. If you are very sensitive, you may feel sore for a couple hours. Also, depending on where it is, the whole point of getting these injections is you're going to go numb. If you're getting them in your neck like I do, expect that part of your face may freeze. For me, here, down, this area, not inside my mouth, thankfully, but here, down to about, about here, all of this, including my scalp, goes completely numb. You will also expect to feel very tired after. It takes quite a bit of energy out of you, whether you realize it or not. So be prepared to, if you have work, take off work for that entire day. Take a nap when you get home and feed yourself. A lot of times I will forget, and then I will wake up after my nap. So say I get a 10 o'clock appointment, come home at 11, take a nap, wake up at about maybe 12:31. I've completely forgotten to eat lunch, and it's now 7 o'clock, and I feel miserable because I haven't eaten. I've slept at least a little bit, but you know, you will feel very cranky. Also, you should expect to feel, you may bleed a little bit, you may leak, more likely, a little bit of the fluid. It will not, if it is staining your shirt, like there is a stain on your shirt, that is something that you should be wary of. If you are bleeding excessively from the site, if you are feeling, if you are throwing up, if you're feeling nauseous, that is common for certain people. But if you are throwing up, if you are vomiting blood, if you are unable to see clearly, or if your vision blurs, those are all signs that you should get yourself immediately to an emergency center, to a clinic, to something. You need to seek medical attention at that point. I will also suggest that for those of you who live alone, to have someone check in on you. If you're coming home from the clinic and you're unsure of how you will react, make sure that you have someone who is going to come to check in on you a couple hours afterwards or the next day, just to make sure everything's okay. Always be honest with the people in your life when it comes to trying a new method of treatment, especially your doctors. Don't lie to your doctors, please. They're not officers. They're not there to arrest you. They're there to help you. So if you are mixing your drugs or whatever, you need to be honest with them. You need to tell them, hey, yeah, I kind of took way too much Tylenol yesterday. I know that's dangerous, and now I'm feeling really awful. Or, I know I shouldn't, but I decided to go for a hike last week, and I haven't been able to move out of my bed. You have to be honest. Please, please, for your own safety, be honest. Because you may not think it's a big deal. It may really change the way that your injections and the rest of your treatment will work for you. Lastly, I would like to say that because this is such a much more complex issue for about 12.5 minutes for me to explain through, I will put more information on my blog so that you can look through it and get a more detailed look into it. This is simply quick and dirty. I am not a registered nurse. I am not by any means a medical professional. I have been getting nerve block injections for over 2 years. This is only my own experience. But if this helps you, I'm happy for that. And if you have any questions, please comment below. I will gladly answer any of them. And I will leave you to that. So until next time, have a great day.